Hello, everyone. This is Chad Middleton from Vision Counseling and Vocational Consulting. And I wanted to come on briefly to talk to you about a service that we're going to be providing our veterans. And I know this is going to apply to a lot of vets. And I wanted to make this uh, available to our veterans with mental health disabilities. Okay. Mental health disabilities. We have a psychiatric nurse practitioner on our staff, and we will begin doing DBQs for veterans that are going to be putting in claims for an increase in their disabilities. Okay. In order for the DBQs to really be credible, you have to have some form of treatment. You need to send us treatment records, treatment notes, or you need to be provided treatment by our uh, clinicians for a number of sessions prior to having a DBQ completed. Remember, a DBQ is pretty much an assessment of the severity of your conditions. If you haven't been to a doctor in the recent 6 months, 12 months or so, the VA will consider your condition not severe and also consider the DBQ not credible. Okay, so to do a DBQ when you have no relevant records, you have no history of treatment, would result in a finding that the DBQ is not credible. We have a psychiatric nurse practitioner, one who's qualified, who has years of experience working with veterans on our staff. And in order for us to do a DBQ for you, for any mental health condition, and that is PTSD, anxiety, major depression, we have to have some form of treatment. Now, don't fret. If you don't have any treatment, we will have to provide you treatment with our clinicians. We have to establish a history and coordinate your sessions where we're providing the mental health treatment. And upon completion of a series of mental health treatment sessions, we will then do a DBQ so that you can file for an increase in your disability rating. It makes so much sense for the VA to deny you and schedule another CMP exam if your DBQs are not credible. It makes sense. But if you have a credible DBQ from someone who's licensed and certified in the field, you really don't have to do another CMP exam because your records would speak for itself. So basically, if you have a DBQ that's already credible and the VA wants to set you up an additional DBQ, an additional CMP exam, you have an option to not attend that exam because 9 times out of 10, they're going to use the VA's doctor to counter or to disagree with the DBQ that you've already filed. Okay, so the way you get this service provided by Vision Counseling, even though it is virtual, even though it will be over the computer, is you need to contact us so that we can set up an assessment. Just like we do with our TDIU process, we're going to do it with the DBQs as well. So you would have to set up an initial consultation. Okay, the initial consultation is first, the assessment is second, and at the assessment, we would want you to send us all of your mental health records, any records from the VA, any records from a private doctor, and if you have no records, we have to establish a history of making you a client and providing you a series of mental health sessions. Hopefully, this is making sense to you guys. All right. And after these series of sessions, we can then do a DBQ and you would submit all of the records to the VA for an increase in your disability. Okay. So again, if you're rated 30%, 50%, 70% for any mental health disability, and you would like to file an increase for your mental health disability, and you need a DBQ, disability benefits questionnaire, which is what the VA is going to do when they send you to their own doctor, you can get that service done at Vision Counseling. Okay, I'm sure the next question is going to be, how much is it going to cost? Well, you have to contact our office and we'll let you know that information as you call into the office, but it's similar to how we do our TDIU evaluations. All right, you come in for individual consultation. You come in, you actually send us your medical records, and then we determine whether or not we can go straight to the DBQ or we can start providing treatment to work towards getting you a DBQ. Okay, we have to make that assessment once we look at your records and once we have that individual consultation. Hopefully this is making sense. If not, rewind or start this video over and understand what it is we're doing. We are providing disability benefits questionnaires for veterans that are considering an increase in their disabilities. Now, we're not doing nexus statements. We're not doing DBQs for anybody who's trying to get their mental health rated. If you already have a rating decision, 30, 50, 70%, we can provide you treatment. We can provide you a DBQ that will help you get an increase in your rating. All right. Sometimes going through the VA process can be very burdensome. It can be overwhelming. You get appointments spread out. You have to go through so much just to try to understand how they're going to process your rating. However, with Vision Counseling and vocational consulting, we're providing this service to you in-house. All right. But you have to go through our process, which is a 3-step process primarily. And that is the consultation. You get to sit down and talk with me one-on-one, find out your rating, get some information from you about your mental health, and then to look at your records to determine whether or not you have any records already that we can review and go straight to the DBQ, or if you don't have any recent relevant records, we'll then set up a series of sessions so that you can get that history, that current history that notes your treatment. Okay. And lastly, provide you with the DBQ in and of itself. Okay. This is private, so it's not like you'll be able to use any insurance or anything like that. But it is somewhat expeditious. We're providing this as a convenience, so it will be some out-of-pocket expense to those that are worrying or wondering about that. We'll talk to you more about that over the phone if you contact our office. But I wanted to do this quick video. Sorry it's so long as it is, but I wanted to do this quick video or audio. I'm sorry. I wanted to do this quick audio on my YouTube channel for those of you that would like a DBQ. Now, when you contact our office, let us know whether or not you are interested in TDIU services or the DBQ services. All right. TDIU services, which is help getting you a vocational evaluation for unemployability, or DBQ, which is designed specifically for an increase in your disability rating. Okay. So make sure you know which service you're interested in when you call and contact the office, and we'll try to get you scheduled as soon as possible. Scheduling is challenging because we have a lot of veterans all over the US trying to get in to see us to get the evidence that they need. But be patient with us. Send us an email or contact our office. My contact information will be listed in the on YouTube in the comments. So please continue to reach out to us. Be patient with us. We're going to try to get you everything that you need in order to get your rating completed and increase with the VA. God bless you. Thank you for this time that you shared with me on today. I wish you a very happy Independence Day on tomorrow. And I hope you have a great day. Thank you for your service to this country. And thank you for considering Vision Counseling for all of your mental health and vocational needs. God bless you.